Good morning, everyone, and welcome to today's student webinar on healthcare careers. My name is Anthony Melf, Project Coordinator with the PA CareerLink of Luzerne and Schuylkill Counties, and it is so good to be with you today. We are a proud partner with Wilkes-Barre Area Career Technical Center, and we're happy to bring you today's discussion. Without further ado, to kick us off, Dr. Tony Gariglia, Chief Administrative Officer with Wilkes-Barre Area CTC. Tony, for a few words.
Well, good morning, everyone. I appreciate everybody who took some time this morning to learn about what you're going to want to do in the future from two very successful individuals that have been where you were. And as we get into this, you'll find out you have a lot in common with these two. I want to thank Anthony, again, our fine host, who has done a series of these for us. And I hope he will be gracious enough to continue these because I think they are excellent, and they will be on our website for later viewing for those that were either unable to or for those that would like to view again. And also thank Ray and Megan for their time this morning out of your busy schedules to help us out in this way. Enjoy. Thank you.
Thank you so much, Tony. Very well said, and it's always a pleasure to be here. With a little housekeeping to get started, just for everyone to remember when they're not speaking, we'll go on mute. For those of us who are joining, whether you're at school, in a classroom, or from home, remember the chat feature at the bottom of your screen. If there's a question that you haven't already submitted for today's discussion, please feel free to type that in. We'll be happy to address those questions throughout our time this morning. I also want to now turn to our panelists. It's very exciting to meet both Megan and Ray. What makes today's panel extra special is that both of you who are successful in your healthcare careers are also graduates of Wilkes-Barre Area CTC, which is very relatable for the students on today's call. So welcome Megan Bartuska, who is an RN and specifically the nurse at Wilkes-Barre Area Career and Technical Center. I am sure it's been a busy year for you, as it is for, I'm sure, Ray, who works as an LPN with the Urgent Care Center at Geisinger, Ray Laudato. Thank you both for joining us. How are you this morning?
Doing well. Yeah, doing good.
Very good. Well, to kick us off, perhaps we could do a brief introduction. And Ray, we'll start with you. If you could just share how you got started in your healthcare career, kind of thinking back to when you started at Wilkes-Barre Area CTC and now you're here today with us working at Geisinger.
Yeah, I originally started my healthcare career as a CNA, and it's because of Megan. Megan told me to go start doing that when I met her. And then I wanted to become an LPN, and Megan had gone through the program already at the Wilkes-Barre CTC, so she suggested it. I went and started there, went through, about a year and a half of the hardest year and a half of my life, but it was well worth it, and it was completely doable. It's tough, but it's doable if you want it. And then I graduated there, continued to work at the nursing home for another 5 years, and then moved over to the urgent care setting for the last 5 years. So that's where I'm at now.
Wonderful.
All because of Megan.
Thank you for sharing. Thank you for sharing, Ray. And I think it's important to note there the building blocks that you started as a CN, then you went through the program, got your LPN, and now the advancement that you don't have to do it all at once. You can build over time. Yeah. So that's really, I think that's important to note for the students today. And I like how your stories interconnect. So Megan, if I may ask the same of you, how did you get started in your healthcare career, thinking back to your time as a student at Wilkes-Barre Area CTC?
All right, am I unmuted? I don't know if I unmuted. Okay, so I went to Wilkes-Barre CTC back in 2006. I was first a CNA, and one of my nurses that was an LPN actually said to me, "Why don't you go to school for nursing?" And I said, I don't know. I don't know if I want to be a nurse. And she said, "Why don't you do it?" So I decided, heck, let's do it. And I went to Wilkes-Barre CTC, and it was the best education I had. I learned everything imaginable that you could possibly want to learn. And then I went on further from Wilkes-Barre CTC to LCCCC for my RN. Where I graduated with my associate's degree. once I graduated from there, I worked in between. I worked full time as a geriatric nurse. I did home health. I used to teach at LCC as a professor. Once I graduated and I was done, I went to Misericordia for my bachelor's degree. I finished my bachelor's and I work at the CTC now as a school nurse. I got my certification from Eastern University. So I have some different background in different fields, and from long-term care to home health to pediatrics. So my going to nursing has to do with, I had a lot of people encouraging me to do it. And also when I was younger, I had a lot of health issues, and I always said I want to be that person to help people. So that's where it came for me, that nursing was going to be what I was going to do. So the CTC is what helped push me along and got me there. It was a hard program, but it was the best education I could have had.
Excellent. Really well said. And again, the connecting the dots, that you can start in one place and you can build on that in other educational institutions, and you found your way back to Wilkes-Barre area CTC as a nurse. And Megan, another question for us this morning. In thinking of your many experiences as an RN and going through that educational journey, can you describe one perhaps challenging experience that you had professionally and what you learned from it?
Oh, there's so many challenging thing that happened professionally. I think the hardest part for me, challenging, was I was going back to school. It doesn't have to do with like caring for patients, but I was going back to school for my RN. I had a few semesters left. I had a semester left. I only had a couple classes, and I was actually pregnant with my daughter. 9 years. She was 9 years ago. And they actually told me that I should just stop right now and stop what I was doing. This is when I was at a different school. And they said, maybe you should do something else for right now. And I fought through it. When you want something that bad, you have to fight, and you have to push, and you have to fight to do it, no matter how hard it is. I went back, I delivered my daughter on the 30th of August, and I was back to school the next day. And you have to fight the next week, actually. You have to fight, and you have to do what you have to do to get there. That was very challenging because the programs are hard. They're tough, but you will get there. For me, that was the hardest part. That was difficult because, you know, trying to figure out what you're going to do and then just having a new baby. And I did it though. And I forced myself and I made myself. So I had the support of my family and my friends right there with me. And I don't want to hear anybody say that they can't do it or they can't financially do it. There's ways. I mean, there's ways to do things. There's different financial resources and different help. And the best way to get into the nursing field, in my opinion, is through the Wilkes-Barre CTC. And I tell this to everybody. If you're looking to go to school and you want to be a nurse, you need to go to the CTC first to fill it out. You need to see that. I learned more at the Wilkes-Barre CTC than I did at any school I went to. And I'm not saying that because I worked here, and I'm not at all, but I had the best education you could possibly have. And it was hard, but I did it.
Well said. I so much respect for you and your journey. And I think also the importance of support systems. It sounded like you had a good support system with your family and friends during that challenging time, and that motivation, that perseverance to continue on. Ray, if I may ask you a similar question, in your professional experiences as an LPN, or even maybe predate that, can you describe a challenging moment and what you learned from it?
It's a tough question. You try to encompass over 10 years of work in one field, especially this field, which every day is completely different. Every day has struggles. You get a couple easy days, and those are called your days off. There's a few of those here and there, but generally, I don't know. I've had days where I've been recognized for things. I've had days where I've done things and nobody knows, and that's just part of the job. We don't do any of this for the recognition. We just show up and we work. We seem to be just a different breed of people. Not everyone's cut for this field. And and it's noticeable. The CTC did a really good job of weeding that out in the beginning, which is super helpful because some people can just pass tests and you can get a high grade and you can graduate, but you shouldn't be in the field. And they did a really good job of finding who should be here and who shouldn't. I didn't think I was one of those people, but it turns out I am. I got that core compassion. I just want to help people. So notable days, which Geisinger noted me for it. There's like a little like web video on it. We had a homeless man come in. It was raining out. He had been released from the hospital. He was wearing paper scrubs, and he needed medications we couldn't handle at the urgent care, just because of their nature. There's like blood pressure meds and a couple other things. So we tried to reallocate him to where he needed to be. We called 911 to get him transport down to another town so he didn't have to walk 20 plus miles in the rain. And I literally gave him the scrubs off my back because my scrubs were the only thing I had on me. I wish I had a spare set of clothes for him, but I literally gave a man the shirt off my back without thinking. And I look back on that, and I don't know if a lot of people would have done that, and I didn't do it for the recognition, and I'm upset. My coworkers put me in for a notification like through the company. I was like, no, I just want to help the guy. I don't want anyone to know about this. Just like let the guy get some help. And we gave him some food and stuff we had. And I don't know if anybody else would have done that. And that's a weird thing to even ask of anyone. So when you get into this field, you don't know you're capable of these things until you put into that scenario. Not everyone is gonna want kids or adults like sick around them, and that's a scary thought. Not everyone wants to go in head first into, especially now, COVID areas. It just scares people so bad. And I show up and I'm ready to work. Bring me everybody. Bring me all the sick people. Bring me all your lacerations. Bring me knife wounds. It doesn't matter. I'm here to help. And we've had people that I've seen through the program and through the school and through my career that aren't stomach worthy of like things like that in the beginning. And next thing you know, they're just like head first too. So even if you're a little squeamish or you're a little standoffish in a lot of things, you'll be fine. You're going to make it through. And what other part I want to talk about? Oh, the CTC. So talk about being prepared for things. The easiest test I took in a year and a half between starting and finishing my nursing career, my nursing start, was my state boards. The CTC prepped me for everything I need to know above and beyond what I needed to know. And the easiest part was taking the state boards, which should have been the hardest, but no, I was well prepared. I felt like more of a nurse in school than I ever have felt out of school. And they did a fantastic job of getting us ready. So if I had a RN program in my area that was at the Wilkes-Barre CTC, I would do that in a heartbeat. But right now I'll stick with my LPN thing. And I never felt discouraged there. I always felt like they were mad at me a few times actually, because they saw my potential and I didn't see it. And I got in trouble for that a few times, but no, they molded me. And then with the help of Megan and then just finding my core values in the field, it just worked out well. I wish I could have a more specific answer to that question, but there's days just even like in the nursing home, just being able to sit with people during their last moments. I've had families invite me to like pretty much be in their family because I'm now a core member because I did something they may not have been able to do. I mean, that's comforting their family member while they're dying, which is a big part of the nursing home, which scares a lot of people, but I'm happy it was me there to do it. If it was one of my family members, I'd want to be that person or someone like me there with that compassion to help. So I hope that answers the question without rounding too much. But
Sure.
yeah.
No, I'm sure everyone on the call today appreciates what you shared. I think you got to the heart of the matter, and I think that's really important.
You ask any nurse, they'll have 1,000 stories, and all of them have meaning. And they're never going to tell you about the bad days they have. They're not going to tell you about the guy that came in and threatened to fist fight you for antibiotics. I mean, you're never going to hear that story because that's minuscule to us. But they will tell you that they had a patient for 10 plus years that started dying on them. And the last week of their life was the hardest week they've ever endured because they're now a core member of your family. Rule number one of being in this field is never get attached. That's the first rule we all break. And that's what makes us like viable for this field. We all get attached, each and every one of us. Ask Megan. Megan's lost 40 grandparents. She's only had what, 4? But yeah, she's lost more than she's ever known. So it's tough, but this isn't something you're ready for, either you'll get prepped or you'll find out real quick it's not for you. And that's one good sorting thing the school did. But I've never been discouraged to drop out of my field at the CTC. I've never been discouraged or told to stop. If they needed me molded a different way, they would help, and they were awesome. So thank God I went there.
Yeah, no, that's great. And Ray, if I may ask you two brief follow-ups on what you shared. One,
Yep.
if someone, I know you, as you said, you did not do that situation, you did not offer your scrubs for recognition, but should someone be interested in watching that video, is that a publicly available video through Geisinger?
Yeah, I'm pretty sure it was on Facebook. It was like 2 or 3. We've been in COVID, what, a year and a half now almost? So I think it was like 2.5 years ago.
Sure. So if anyone's interested, maybe Geisinger Facebook, check out their video section. It might be there. If, certainly if someone has the interest, I think that's wonderful.
Yeah.
And you were touching on core values.
Yeah.
And you talked about, having, that compassion for other people. Do you mind elaborating on any other core values you think are important to the field in addition to compassion?
Compassion really sums it up. If you have the will and the drive to do this job, we go above and beyond. We put ourselves at the bottom and everything above and in front of us. I know we get a bad rap sometimes for being grouchy or grumpy because you always see like, oh, this nurse was mean to me, but you also don't see the 10 other patients. You don't see the ventilator patients. You don't see that this nurse is trying to juggle their home life. You don't see the 60+ hours some of us put in a week. You know what I mean? And it's easy to see from the outside how hard it is. And then once you see the flip side, because in my head, so this is like pre-nursing, I always thought I wasn't cut for this field because I thought it was just angels working in this field, like just super calm and composed, like male and female workers. And I didn't think that was me. I get a little like hot-headed sometimes. I get a little stressed. And you get into this field and I find I'm one of the calmest people when I'm in it. It's more so not for me. It's more so because I need to portray that for my job and my patients. I need to be there for them. It's almost selfless. Yeah. And there's so much information you're going to get in school, and you're going to lose a lot of it unless you specify in a specific field. And don't worry about that. Like I couldn't read EKG strips for the longest time, but I got in nursing school. That's all I had was cardiac floors. So I was like top tier, like EKG strips. And that's one of those things that like I prided myself on in school. And then I got out and I didn't do it for 5 years. And you kind of lose a little bit of that like specificness. But once you start to pick it back up, it's right there. So don't overthink your job. Your job will train you to do what you need to do in the field. Don't overthink your training. You're trained to do everything. And this job is vast. But when you as a person are good for the field, you'll be fine. If you're struggling, you can learn. I'm pretty sure I could teach my 9-year-old how to do this. I wouldn't stress her this early in life to do it, but the job is teachable. Core values, we all fit. It's like one of those things when like you meet new friends and like, oh my God, like we're best friends now. Like that's all of us. We all have the same core values. And I don't know how that happens, if it's metaphysical or whatnot, but we just all gravitate to this field. There's not many people in the field that shouldn't be here. So it's just compassion, it's strength, it's understanding of other people. It's almost being an empath, so you can just pick up and read and feel. And it's something different. Like I said, I didn't expect to be here. I grew up like turning wrenches with my dad, doing like what they consider now HVAC work. I thought I was geared to go to the military in the beginning. I unfortunately met a very pretty lady, and she put me in the medical field. And now she's still ruining my life 12 years later. Yeah, it's my wife. No, I wouldn't change anything about that though. So I'm saying like this isn't one of those things I expected, and I excel. I hate saying it because I hate putting myself above anyone else, but I excel in this field so well, and I would never have imagined this. So
Ray, thank you so much for being so open. I think that's really helpful for people because you're being really honest. And I think that is going to connect with people who may have similar doubts, similar thoughts.
Oh my God, yeah.
Different journeys, right? And
I almost failed out. I did. So the CTC has 4 levels. I almost failed out 2nd and 3rd level. It was just trying and I barely made it. And on paper, I was one of the lowest LPNs, I'm assuming, in my class. If you look just on paper and tiers and stuff, I was on the bottom. But everyone I've worked with, they can't believe that when I tell them I'm intelligent. I just had trouble with testing. And I can't sit still for too long. So this field's great for me to move all day.
That you have, and that you have. And I think there's actually a nice segue here. And you had touched on, in the many things you shared, which we appreciate, you had touched on the training and kind of some of the doubts and thoughts you have during training. Our students asked, and I'll put this out to both you and Megan, are nursing clinicals hard to do? And how long is a clinical day? So thinking back on your own experiences, if you want to share a little bit, I know that's like an open-ended kind of broad question. Are they hard? And how long is a clinical day? If Megan, maybe we'll start with you and then we'll come back to Ray.
Okay. So clinicals, they're not hard. When you get out there, you will know exactly what to do. They give you the foundations. When you're in class, they give you the foundations. Hi, honey. They give you the foundation and they give you everything that you need to know how to do a bed bath, how to do a dressing change, how to help a patient, like how to take vital signs. So you have all the foundation and you have all the skills. You were taught this already prior to going. You're not going in there blind. They're not just going to take you out into the field and say, here you go ahead and go take care of these patients. That's not going to happen. Okay. So yes, at times clinical is hard and it gets scary, especially when you have a patient that's coding and you have to jump up on the bed and you're the one that has to do it. And you're there and you have to do CPR and you're there and you're with a nurse and they're like, come on, let's go. And you're just a student, but you know how to do this. Yes, it's hard at times, but it's 100% worth it. You know what you're doing and it all just clicks. It's all like what they teach you. It's hard to explain because you don't think when you're in class sitting there during lecture and hearing the teachers that you're going to know what to do. But all of a sudden, it just clicks in your brain and it just clicks that everything is, oh, I know how to do this. I know how to do an IV. I know how to take care of this. I know how to do a colostomy bag. I know how to do this. So yeah, clinicals could be hard, but as long as you're following through with your classes and you're there and you're paying attention and you look and see the foundations that they're teaching you, you'll be fine. Your normal day is it depends, 8 o'clock until 2. So you're there from 8 to 2. You do get breaks. So you start your morning, you give your patient breakfast. You help them with their breakfast. Sometimes you have to feed a patient. Then you're going to do your bed bath or your shower. And then after that, you usually have some downtime. You look at your labs and you see what needs to be done. And then you have time after that, it's lunchtime and it's time to go. So it's not like the day flies by. Clinical isn't like, it's not like you're constantly going. Yes, you're going, but it's all organized and it's all flowing and everything works out perfectly.
Thank you. And Ray, do you have anything you'd like to share in your experience?
Yeah, no, she hit most of the bases. Clinical is literally what you make it. It's like any other day you're going to have. Some days are just longer than others. Some days are quick. You blink and next thing you know, you're like, oh, you guys are good to go home. You'll find an adjustment period in the beginning where everything's scary. You get your assignments a couple of days, like a week, I think it was before, and you're doing all this research and you're checking up on your patient and like without meeting your patient yet, you have all this information and you're ready to go. And you get out of the car in the morning to go to your site and you are just going to be lost. You're just going to be standing there going, I don't know.
On Ray, there you
Sorry,
go.
I was getting an incoming phone call. It said, once you get to your car in the morning, you're going to be lost and you're not going to know what you need to do. And then when you get in there, you realize this isn't a human being. This isn't just numbers and pieces of information. And you introduce yourself and you get nervous if they're going to hate you because you're a student nurse or you're young. I've had to have personal talks with people almost 3 times my age, and they've asked me if I'm a little young to be doing this. And I'm like, well, you got to start somewhere. And I always worked well with humor, and that always went well for me. But yeah, no, that day is literally only as long as you make it. It's stressful, but it's doable, and you get all your building blocks before you step foot in there. You have your instructors on site ready to help if need be. It does get hectic sometimes. I've been part of codes. I've been a part of syncopal episodes. I've done feeding. I've done trach care. Like you're just going to do things. You're just like learning any other job. If you've ever worked a day in your life, if you remember the first day of kindergarten, when you walk in and you're like, how do I make friends? Like, are people going to like me? Back to square one. And then you just move forward from that day. You're going to be okay. There's plenty of nurses out there. We don't give up. Yeah. And dude, it's a good field, man. So there's no easy way about it. You just got to get in there and do it. Clinicals are great. Clinicals, I loved clinicals. I love taking my theory and applying it in the field. I love doing actual skills. Skills lab in school is one thing, but getting in school and actually getting like the ability to put an IV into a vein, it's awesome. Like getting that blood return, being able to actually like drop a catheter in and seeing urine return, or like I never got to, but I've seen a couple students put in NG tubes, which is pretty fun because the theory is like weird. And then once you get in there and do it, it's just smooth and it's easy. And then you get to talk to doctors too sometimes if you get a chance to see them, if you're there early enough. They're a plethora of knowledge and they love talking to us and giving us information. Doctors love talking. It's their favorite thing. I don't know if Tony will back me up on that one because he's a doctor in a manner.
I think everybody would back you up on that.
Yeah, but yeah, no, they love giving information. Even my OR rotations, that was awesome. That was super nerve-wracking. I got to see like a full hysterectomy and like just watching those doctors smoothly work. It's not like on TV where it's like you watch a doctor like Grey's Anatomy or something. It's not as flashy as that. But just being in there and watching them just be masters of their craft and like watching nurses assist them and do that, that's so awesome. Everything's particular, everything's timed. It's like an OCD lover is like the dream to be in that room because everything is in its own place and everything's accounted for. It's a really cool experience. So yeah, don't be nervous. You're going to be nervous regardless. You're going to be, and it's easier said than done. Just go in, breathe, make sure you hydrate and your sugar is good. Don't need anyone passing out, but you're going to be fine. Everybody makes it through who wants to make it through.
Well said. Megan, I turn to you. So we had some students ask about the LPN program at Wilkes-Barre CTC, and they were curious as to how many courses would they have to take. And you touched on this a little earlier, so if you don't mind expanding on the expense. So there was questions on the expense of the program, and I think you started leading in with some good advice regarding not, seeing that as the, how to resolve that barrier towards successfully entering the program. So if you could talk about the coursework and the expense, that would be great.
Okay, so the CTC program, I'm pretty sure right now it's around $20,000, which I know you're hearing that and you're like, oh my Lord, $20,000. Well, guess what? It's the cheapest program around. And I'm not even joking or not even just saying it. It's the cheapest program you're going to find around. Okay, so it's $20,000 and there's 4 levels that we go, that as the LPN program goes through. There's 4 levels. You start your first level with your basics. You start with your anatomy, your dosage calculation, which is a math class, your anatomy, your nursing 1. They do like a gerontology, and they do a nutrition, and they do P&V, which is like a practical and vocational class, which is about nursing, how to transition you from somebody off the street, because we're coming in, you got to remember, you're coming from off the street, wanting to be a nurse, how to have the mindset of somebody that's going to take care of somebody else. So they're teaching you how to be that person and what to do. So they're training you, they're teaching you the different things, how to talk to patients. So that's your first level. They're teaching you that. You have a lot of practicums. You don't start clinical immediately within the first level. Clinical you wait until, I think it's usually you only have like maybe a month left of first level when they start making you go to clinical, and it's simple. The first level is simple. If you're in Miss Labruto's class right now, which I know some of you are, me and Mrs. Labruto both worked together at the CTC up there, and we taught CNA the course. So if you're with her, she has prepared you for this first level. You have nothing to worry about. You don't need to worry. You don't need to like get all panicked and scared because you're ready. You know what you're doing. The first level, you're going out there, you're doing a bed bath, you're doing your vital signs. I guarantee you, most of these kids that are out there watching us right now have an idea of how to do vital signs. They know how to take a temperature, a blood pressure, a pulse. They know how to find respirations. So it's there. You have that, and that's what you're going to do your first level. Then you go into your second level, which is another bunch of courses, but now it's more in tune with nursing. You have your nursing 2. Then it goes into the basic systems within your body. You go into your integumentary system, your cardiovascular, neurology. So they separate all of that by different levels. And usually the last level, which is right before you graduate, is when you have your, and I'm thinking they do cardio and neuro last, and they teach you about that, and they teach you about how the heart functions, because you got to remember, everything is intertwined together. And honestly, you don't think that it makes sense, but then all of a sudden you're like, wow. So if it goes this way and it goes that way, you got a connection, and this is why this is happening. It clicks. So a lot of times you think that you don't have the money or the resources to help with assistance to pay for school. That kills me when I see students saying that their parents can't afford to send them to school or they don't have the money. There's resources out there. There's student loans. Okay, you don't want to pay back a loan. I get it. Listen, I'm still paying my loans. My husband's still paying his loans. We'll probably be paying them for a while, and that's okay because we did what we wanted to do and we did our career. There's options though. CareerLink, for instance, has programs for people if you need help. I remember when I was in school, they helped a lot of people. Young mothers, they helped students to go back to school. CareerLink, OVR, there's so many other options. There's different financial resources, scholarships. The CTC takes on all of those. They take on scholarships, they take on grants, they take on loans. You could do a personal loan through your bank. You don't have to ever say that there's no way to get funded or to pay for school, because there is, I promise you. You will find a way. If you want it that bad, there's a way. Yes, it is. $20,000 seems like a lot of money, but $20,000 over a lifetime really isn't that much. If you're a high school student and you're working at McDonald's or you're working at Burger King, they personally offer at least $2,000 to $3,000 a semester, which to me is amazing. That's a great thing because that covers a lot of your cost of school. Or if you go into a nursing home and the first level of nursing school, you're allowed to challenge and you could get your CNA immediately. You go into certain nursing homes, they'll pay for the rest of your schooling for you because they want nurses so bad. So there's options there. So don't be afraid. And if anybody has questions, anybody that's from my school and wants to come up and ask me, I'm just working from home today. You want to come up and ask me questions, or you want information, or you need something just to help you, come up to me. I can help you. I'll guide you. I'll show you what you need to do. You have this. You will do this.
Megan, thank you so much for touching on a lot of really helpful paths forward, including PA CareerLink programs, depending on the individual program requirements and income-based need. There is potentially a path forward through some of our PA CareerLink programming, but you also did touch on a few other areas. I wanted to add that Educational Opportunity Centers, Inc., EOC, based in Edwardsville, does a really good job of meeting with anyone in the public, anyone in the community, to discuss financial aid pathways for education. So if you even wanted someone just to sit down with you and look over what that financial aid could look like, that might be a resource to take advantage of as well. We did have a few questions from students regarding earning potential in the healthcare field. And I want to kind of put that out to both Ray and Megan. What are reasonable expectations, perhaps, as you get started in the field in terms of earnings? Ray, if you would like to go first, and then Megan.
So I don't have like the specific stats or like data information on it. It's all searchable. Like you can look up any career, especially in this state, for salaries, but it really depends on where you go. Most LPNs are going to gravitate towards a nursing home. That's where they utilize us a lot. The urgent cares have picked up in popularity, so we utilize a lot of LPNs, and then there's doctors' offices that utilize a lot of LPNs. Most starting rates are going to be anywhere over 15 to 16 an hour where they should be. Some places a little bit lower for student LPNs, because you'll see that rate too when you start. And that's just until you get your board certification, and then you can get a higher rate. But there's places like agencies that offer upwards of like 23, 24 an hour. And that's to start. So a lot of there's flex positions, there's floats, there's all sorts of things. So when you're looking at your entry level positions, they'll give you a, like, I know Geisinger, because it's where I've been for the last 5 years, there's every job has a limit, like a min and a max. And when you start, they're probably going to try to push you towards that minimum, because that's just how it works. Welcome to entry level anything, whether it's us or Burger King or anything like that. Everyone has an entry level position, but most places should be starting, it's been a while since I started, at least 16 an hour minimum, I'd like to believe, but I haven't seen those bases. We just recently changed our pay grids. I think our starting rates should be 16 or 17, but don't quote me on that because I'm not 100% sure. I haven't seen that information in a while. Thank God I haven't had to look for a new job. But yeah, I think mine caps out at 25. 24, 25. And then if I find a different position, I get a new, if I go back to school for my RN, we're probably starting at that cap level for me. So it's always forward progression. And don't be afraid to ask for a certain amount of money. Obviously, most places won't hire you at their top tier, but like if you think your time and your value is worth a certain amount of money, feel free, negotiate. The people you're negotiating with are trained negotiators for their company. Like, don't like, it's their job to offer you something, and then you make a counter offer, which is fine. Don't be afraid to apply to multiple places. That's fine. Ain't nothing wrong with that. Everyone's hiring. They need LPNs, especially now more than ever. And you're a commodity. You know what I mean? Like, you're something they need. So don't be afraid to put yourself out there and ask for the money you need. Just don't be unrealistic about that offer, though. That first offer. You don't like day one, like no experience, ask for 25 an hour. Because the jobs that will pay you 25 an hour to start with no experience, you're not going to want to start those jobs. They will burn you out so fast. There's jobs that will take brand new nurses and do that to them. So just be mindful of that, especially now because they need the help. But what did I get offered not too long ago? When COVID started, there was a nursing home. They were desperate. They were offering almost $1,000 per shift. But when I called up and asked about it, it was like a 50 or 60 bed facility. They were 90% COVID positive. And that was why, like, they didn't advertise that. They didn't advertise the shifts you'd be working. But I had the experience and I knew to ask that question. I was like, hey, what's your COVID? Like, how many people do you have that are positive? And she was still a little hesitant to tell me. I'm like, no, like, I'm in the field 10 years. I know why you're offering this amount for this job. So just be mindful that when you're picking a career path, sometimes that extra money isn't great off the start because it's a high burnout rate for us. It's a tough job. And you don't want to get thrown into something you're not ready for and then ruin all your confidence on day one. You don't want that. I'm one of the main trainers for my job. And I got a lot of nurses who come in, or MAs that come in, and they're just scared and they don't know what to do. And I'm like, no, just listen, follow. We're going to be fine. We're going to get you through this. And I guide all my nurses and all my new employees through that. And like, even when they're doing well, I'll tell my higher ups, don't tell them I do this, but I'll tell them they're not doing great just yet, just so I can guide them further until they're 100% comfortable. Because I don't want to get them put into the field and then get nervous day one, or even if like they're 6 months down the road and like, how do we do this? I'm like, yeah, call me up, hit me up on my day off. I got you. I can do this in my sleep. Like, I've been doing this so long. So yeah, like I said, we're a weird group that I didn't never expect to be a part of, but it's almost like a family worldwide. You meet other nurses and like, oh my God, you're a nurse too. I mean, and then like you have like friends forever and family forever. So money wise, it's better than working like a minimum wage job. You're going to get paid way more than that, which is great. And then as far as Megan said about like worrying about that 20K, and like, I know I said I'm working 10 years, I'm still paying loans. That's my own fault. I kept doing forbearances and like putting them off because life happens. I could have paid my loans off in 5 years, easy. I could have paid them off in 3 if I still lived at home. But like Megan said, we had a baby. I wasn't leaving my family, so we moved in together. So I didn't have that luxury. If you can have that luxury of staying home for a few years, if you have that opportunity, do that. Don't be ashamed of that. Be a nurse, pay your stuff off, move out, get a nice place, no debt, making crazy money. Good to go.
Well said, Ray. Thanks for sharing and helping the students, and all of us really have that more reasonable, expectations, realistic expectations. And also, I think there's encouragement in knowing there are people like you in the field that are there to truly guide and help people who are just starting out navigate and build their confidence. Megan, do you have anything you'd like to add to what Ray shared?
Well, my biggest thing is yes, money is important, but you have to follow what you love. Okay. And starting LPN is 15, 16, 17, depending. It depends on what shift you get your shift differential. If you go 3 to 11 or 11 to 7, which is great. You want that. I mean, if you want it, the money is important, but you have to follow what you love. If I was right now working out in a hospital or in the nursing home, I'd be making money that, I'd be making $30 an hour, $40 an hour if I was doing an agency. But sometimes you have to follow your heart and go with the job that you love. And personally, I love doing what I do. I love being able to work with students. I love being able to work in a school district because I always wanted to teach. So I'm able to do that, and I'm able to have the best of both worlds. I'm able to teach because I could teach students how to do things as a nurse, and I could still do my nursing job, and I have that aspect of that. So it's not all about the money. I know the money is important and you want that. And yes, you need that to survive, but you have to follow where you want to be. So if you want to work in a doctor's office, work at a doctor's office. If you want to work in an urgent care, work there. It's not all about the money and all about, I need to make $25 an hour in order to sustain my life. That's not how you have to look at nursing. Nursing is it's not money. You have to be compassionate. You have to be caring. Money is important. We need money to survive, but you have to have the heart to do this. Because sometimes the things we do and the things we see, there's no amount of money in the world that could ever make those things okay or make you feel okay having to hold somebody's hands while they're passing away or be there when they don't have family or just watching a resident that you had for 10 years that you called Graham every single day that saw your daughter as she was born and held her, and you have to watch her pass away. There's no amount of money that could ever take on that and replace that, losing someone, losing patients. And it's just a different, you have a different mindset. Nurses, we don't get paid enough. We don't, but it is what it is, and you have to love what you do. You really do. And I apologize. I have my kids home with me, so you probably hear them yelling.
That is very much okay. That is 2021, right? That is the modern workforce where we're all trying to adapt. So we appreciate you taking the time to be with us this morning. And just a few other questions as we turn the corner here and our time comes to an end. Some students, you had to kind of touched on, you have to do what you love, right? And some students were inquiring if either of you had thoughts or recommendations on programs for the following fields. So surgical tech, physical therapist, or physical therapy. Do you have any thoughts or knowledge on programs that these students potentially could look into?
All right, I'll jump on that one. So surgical tech is an awesome field. If you're going to go into surgical tech, the best field that they have, LCC has a wonderful, wonderful program for surgical technology. It's not a hard program, which you want to go to surgical tech. I don't know why you're not. You're just going to go be a nurse and work as an OR scrub nurse. Why not go to Wilkes-Barre CTC, get your LPN, and you could be a scrub nurse. Mind blowing, but I know. I preach for the school because the education you get is just unreal. So surgical tech, the LCC is phenomenal. Now, if you want to get your physical therapy, Misericordia and Marywood both have a phenomenal program. Their program is just amazing. And I actually saw people when I worked in the nursing home. So they would work with me and they would work side by side because we would have patients that needed to do physical therapy. So Misericordia's program was phenomenal. So if you're interested in that, I would check out Misericordia.
Thank you so very much. I think program leads are really, really helpful for students as they explore their career options moving forward. 2 more questions for both of you today. You touched on this throughout the morning, but we'll go to Ray. Any specific tips on good bedside manner, best practices?
Tip number 1, which I learned in school real fast, just watching everyone around me do similar things and then do different things, and from being in the field this long, don't be fake. Your patients can spot it a mile away, your staff members can see it a mile away, but outside of that, it's going to burn you up. Being somebody else at work and then being a whole different person somewhere else. Don't put on a persona, just be yourself. I said before, humor is usually my go-to. Levity and like light situations make everything better, but there is a time to be serious. So be mindful of that. But I don't know, just don't, if you were in that bed or your mom or your grandmother or the person you cared about the most in the world was in that bed or came in to see you for something, how would you want them treated? I tell my patients all the time, because I unfortunately go above and beyond, just built into my core. I just do too much sometimes for my patients. They always ask me why I do this, and for 10 years, my go-to answer has always been, I'm eventually going to need the same help or similar help, and I would like someone like me to be there and do this for them, or do this for me. You know what I mean? If I was the patient, and that's always my driving factor. There's no reason, even if I'm having a bad day or like I'm stressed, for you to come in sick or unhealthy or needing advice or testing, and you have to get attitude from me. No way. Nope. That's not something you ever want. Nobody wants to go in to get their blood drawn and see their nurse or phlebotomist just grumpy. You're holding a needle, you're going to access something in my body. Don't have that. Like, just when you're at work and you do your job for your patients. We're now there for something that's more than us. And that's the biggest thing you got to remember. And it's easy to slip. We all have bad days. Like, you're going to be grumpy sometimes. You're going to be stressed, especially now with everything going on. But just got to be mindful. These people are here for your help. Your main job is to help. And that's what we do. And the other thing too, don't beat yourself up because you can't fix everything, because that's stressful in the beginning. You want everything to be good and you want everything to be perfect. And it's not going to be like that. You got to be malleable. You got to be flexible. You got to be able to do the job in its entirety. And sometimes that entirety is understanding that some things can't be fixed. And that's a tough one too. And you got to not let your patients read that on your face. You got to kind of hold that one back a little bit. And yeah, just be mindful of every patient's different. We get a lot of repeat patients in the urgent care because we service the community. We're one of the closest urgent cares. We're one of the only urgent cares that has like a big walking community down in Pittston. So we see some of our patients are like regulars in the manner like, I'll see them here and I'll see them a couple months later. They have like a couple kids. So I get to know the whole family and they come in like, oh, Nurse Ray's here. And like, it's a good thing because like I'm great with kids. Apparently I had no idea I'd ever be that good coming from the nursing home, being that great with pediatric patients. And like a lot of kids, they have one bad experience and that's it. But I have a lot of kids that will only get swabbed by me or like only let me do certain things with them because I'm so calm. I have a couple autistic patients that come in that the second they see me, like they're not like as worked up. I had one where the way our building is set up, our lab for the main building, if you just come in to get lab work, is like 60 feet down a hall or maybe 40 feet down a hall. And I heard a young lady screaming. So this isn't even my job area. It's out of the urgent care. It's not my responsibility, which you'll hear that a lot, not from me. I heard someone screaming. So I walked down there and it's my patient with autism and she's sitting with her mom and she put her hands out to hold me. I'm like, all right. So mom moved out of the way. I sat with her. She got her blood work, didn't flinch because I built a rapport with that patient, you know. But if you're a hospital nurse, you don't always get that. Like your first impression may be the last time you ever see this patient, and you got to make that first impression count. And you can't come in like a hotshot nurse and like, you're doing this for me, you're doing that for me. You come in and you go, listen to these things we got to work towards today. We got to get some blood work. We're going to go down for some x-rays. I'm gonna need you to hydrate. I'm gonna need you to count all your urine. If you go to the bathroom, if you get up, do not leave your bedside. You can leave your bedside. You just kind of lay down the ground rules friendly, and not as you're coming off as like a dictator telling them what they can and can't do. The old adage of being a nurse ratchet, you know what I mean? Like, you don't want to be a stern nurse. There are times for that where you have to be stern with your patients. 90% of the time, you're going to be talking to them like they're just normal people and everything's fine. And that's what you have to do. You have to maintain that level of calm. And you need to maintain that level of not being like overly friendly, but professional courtesy, where you're, or like I've had nurses throw out a bunch of like medical terminology at people that don't understand that. I don't have to come behind them and just lay it down in English. That too, just be mindful of that, because you're going to get drilled in nursing school with medical terminologies. Because I used to get in trouble for not using them because I would talk to people like normal people. So yeah, just you'll see. Just be, yeah, just it's what the golden rule: do unto others as you want done to yourself. So
very good tips there, Ray. And Megan, do you have anything you'd like to add on bedside manner best practices?
One of the biggest things that you're going to hear, you'll hear this in work and school when you're there, that nurses eat their own. That's one of the biggest sayings that we were always told. That was something that was always scary. When we were in nursing school, they would always say, you know, older nurses eat their own. Or when we were in the nursing home, they would say that. No, nurses are the friendliest and they will help. Don't get me wrong. Some nurses could be brutal, but they are doing this to test you and make sure that you are on top of your game. They are trying to help you. They are trying to get you to that excellent point of where you need to be. They're going to get you to excellence. They are trying to build you to be the nurse that you're supposed to be. You have veteran nurses that are nurses for 40 years that might be a little bit of rough around the edges, because don't get me wrong, I've had nurses that were not so nice. I've had some that were sweet as anything, but they're training you, and they might be a little bit, you know, they might not be the nicest all the time, but that's their way of showing you, like, this is how you do it. This is what needs to be done. So don't look at it as a bad thing. Always never say, I never want to hear, and it's one of my biggest pet peeves. I used to hate hearing it with my CNAs and my other nurses. It's not my patient. That's one thing you never say. It's not my patient. Don't ever say that. Every patient, even though you might not be caring for them, they might not be on your little piece of paper, but every patient in that building is ours. When you're out there and you're doing something, you got to remember that these people are in your life. They need to do something or they need something. Find somebody to help them. If you could help them, help them. Don't say they're not yours. You might not know how they transfer. You might not know how they do something, but try to find a way to help them. Just think of being that person and think of sitting there and them needing to use the bathroom and not having an ability to, or them crying out, needing help, or having Alzheimer's and looking for their family. I worked in an Alzheimer's unit and they used to just cry and scream. Sometimes you just need to sit there with them and you just need to hold their hand and say it's okay, or take them for a walk down the hall. Might not be your patient, and you might be busy and you might have you might have your meds to do and you might have treatments to do. 5 minutes is all it takes to stop somebody from having a world thingy going on, that their mind is racing and they're scared, and then their behaviors start. So just remember that every patient in the building is your patient. So that's one of my biggest things I can give you is just be compassionate, be caring, and always look at them as if it's a family member, or it's your mother, your brother, your sister, cousin, somebody, and just treat them how you want to be treated or how you want your family to be treated. Don't go in there with the ideas that you have to rush.
Thank you so very much. And to close this morning's webinar, one final question. We'll go to Ray and then we'll end with Megan. If you could go back to when you graduated from CTC and you could share one piece of advice with yourself, what would it be?
Oh man, it's a tough question. That guy was a whole different person. If I could tell him anything from 10 years ago, I would probably just tell him to continue, get my RN. Don't wait as long. And that I should understand I'm worth more than I thought I was, and I'm a better nurse than I thought I was, because I was really doubting myself in the beginning. I knew I was good at my job, but I didn't realize I was a great nurse. And I still hate saying that because I always assume I'm on the bottom of the totem pole. Like, I want to be the base for how good people can be, and everyone should be better than this. And that's more on what Megan was talking about too, about we always push ourselves further in the field. So it's always forward progression. So if you're thinking about getting your RN, don't get complacent working 60 hours a week straight out of school, making like good money. Like, you can survive, go back to school and finish. You know what I mean? Go get your RN right away if that's something you want. If you want to find a specialized field, go for that. Because I could have done that. I could have been in a specialized field for that. I loved wound stuff, but I never went for it because I never thought I had the time. And looking back, I had plenty of time to do that. I don't now because of everything going on. But yeah, like, don't be scared to go get it. You just went through one of the hardest programs available. Not knocking any other program, but this field's tough. The training's hard. The entry's hard. The required information and knowledge base is a lot. So it's doable. And it's something you just completed once you get out, and you got to be mindful and happy about that. I remember the first thing I wanted to do once I got out was just do absolutely nothing, just because I was so drained from a year and a half of just running and working and memorizing and learning ins and outs of everything that I've never even dealt with before. So I do it. You guys, Megan, it took what, like 3 months off, didn't do anything nursing related, just my normal job at work, and like didn't talk about boards, didn't look at anything, just took mental health for 3 months. But yeah, I probably tell myself to keep going, which everyone else tells me to keep going. So maybe one day I'll get back in that school and get my RN, but I don't know. We'll see. Megan's gonna tell me to get my RN right now.
An important encouragement for everyone on the call. Megan, same question to you. One thing that you could tell yourself upon graduation, looking back, what would it be?
Oh, that's a tough one. It would be go back for my RN sooner. I mean, it would be definitely go back sooner and get it done. Don't be afraid. I was so afraid to go back and get my RN. I had the foundation from the CTC. I mean, I had everything. When I went for my RN, which LCC is great. When I went for my RN, I was able to do everything that the RNs were able to do. Like, I had it. I was great at it. It was wonderful. My program was fast. By the time I was doing it, it was, I don't even know how to explain it. Like, the instructors trusted me enough to do it. So don't wait. Don't doubt yourself. I doubted myself, like Ray said. Sorry about that. You doubt yourself, and you don't want to doubt yourself, but you do. Just keep going and keep fighting and keep pushing yourself, because I promise you, you'll do it. And it's the best feeling in the world. Walking across that stage, actually, Dr. Gariglia is the one that pinned me at graduation. And it was the greatest thing ever, getting that pin and knowing that you have made it through the hardest 15 months of your life. And just to see your family sitting out there in that audience and watching you, and you could see your mom and your dad and your siblings, that right there was everything. So, I mean, I did what I needed to do, and I think it was the best decision at the time. And, you know, if you're going to go to school, if you're going to look into nursing, I highly, highly recommend the CTC, the LPN program. You learn so much, you get all your basics. And then if you want to transition into getting your RN, they have a beautiful affiliation program with LCC. They have them with Wilkes. I mean, there's so many options out there for you. Don't be afraid. You cannot be afraid of what we have to offer and what nurses have for you and what our program has.
Megan, Ray, thank you so very much for your time this morning. Truly was a pleasure to meet both of you. I'm sure our students and faculty appreciated your time as well. Dr. Gariglia, if you'd like, please rejoin and close us out with any final thoughts. Thank you all so much.
I just want to quickly thank Ray and Megan again for their time, and Anthony for your time, and the students and Mrs. Labruto. I do want to mention you got real, raw, honest answers here. I think we have done a few of them, and this I thought was so wonderful in looking into the real lives and the real things that occur as you're trying to move forward with your careers. No, you guys aren't alone, which is the greatest message I think we got here today. So thank you all again.
Well said, Tony. Megan, Ray, thank you for your time today. Thanks for doing what you do. And I wish everyone a wonderful rest of the day. Take care. Thanks.